Hello, Year 12s. We're moving on to Unit 3, Area of Study 2. And we did actually go over some of this in the last week of Term 1, but I understand a few of you weren't there, and it's worth going over it again anyway. So this is the information from the study design on this topic. So we're looking at how Australia's health has improved since 1900, so over the last 120 years. And we'll move on to looking at some of the reasons for these improvements. So looking at things around public health and some different approaches to health that have come in since the 1900s. But for this PowerPoint, we're really just going to focus on these improvements that have occurred in different areas. Just while you go through this video, I recommend at times that you pause it and have a think about the questions on there like we would do in class. So I'll guide you when to do that during the PowerPoint. When we did this in class, I got everyone to have a think about what Australia might have looked like in the early 1900s. Because if we can understand a bit about the lifestyle, things like housing, nutrition, what kind of work people were doing, it gives us a lot of information about what health would have looked like. So this could be a good opportunity to pause the video and have a think about each of these questions. In general, in the 1900s, people were doing a lot of kind of labour type work. So they might have been working on farms or construction, so things that involved a lot of physical labour. We didn't really have offices and people kind of sitting down and doing a lot of jobs. It was quite physical. And in addition, there was educated people doing jobs like doctors, teachers, those kind of things. But the majority of people were working in quite difficult physical work. Housing was very simple. Not many houses would have had any electricity or things like proper heating, even good ventilation and windows. And also there would have been a lot of overcrowding. So people living in close quarters to other people, and also not a lot of hygiene, so things like running water, and that is quite important when we look at changes in health. In their spare time, people would have been outdoors quite a lot, and again doing quite physical activities. People weren't generally driving around in cars. They probably would have stayed quite close to the areas that they lived in. In terms of where people lived in Australia, traditionally people have lived in kind of rural and regional areas. So for things like farming and also the gold rush and mining and things like that, had a lot of people living outside of the cities. But around 100 years ago, we started to see more of a move into cities. And that was as the cities started to develop more and there were more opportunities there, but also as things like the gold rush kind of ended and people left those places. So there was a bit of a transition then. Obviously, a lot of people kind of stayed in rural areas, but we got more moving to cities. And housing would have been quite different depending on where people lived. People in rural areas generally had a lot more space and might have lived in kind of farmhouses, and in the cities is when we tended to see more of the overcrowding and living very close to each other. If you think about what people ate, there was no processed foods. So people were eating quite simple food that would have been easily accessible. So there wouldn't have been a lot of food being imported because it would have taken so long for ships to arrive. So it would have been things that could be grown quite easily. So lots of wheat-based things, lots of breads. There would have been simple vegetables like potatoes and carrots and things like that. And maybe a bit of meat if the family could afford it. Okay, but not really any processed sugar or anything like that. How do people get around? Well, most people were walking. If a family could afford a bicycle, they might be able to ride around on a bike. The majority of people would have been walking, and obviously very wealthy people might have had access to things like wagons or horses. But all of this gives you a bit of a clue as to how people's lifestyle was in terms of being quite physically active and also not eating a lot of the food that we eat today. And this last one, do you think people would have had more or less children than they do now? In general, more, and a lot more. A lot of families might have had kind of 8 to 10 children, whereas now, you see kind of between 2 and 4 is fairly common. And the big reasons for that were there wasn't a lot of education around having children or how to space having children. And also there was no contraceptives available. So people didn't really have much option for contraception. And another important thing is having a lot of children was often a benefit for the family, especially if you had a family working on a farm. That meant more people that could help out, or if you relied on your children to go off to work to earn money for the family, obviously more children allowed that as an option. So this is just a nice thing to come back to, just to, as we look through some of the changes in health, if you can compare that back to lifestyles, it makes a lot of sense. These are just some photos that I found that I quite liked of Australian life. So here you can see kind of women doing the washing outside, and that very much would have been a woman's job. So women would have taken care of all the kind of household things. Here you can see just a family out on their farm. So remembering a lot of people were living quite rurally. And farms might not have been as big as they are now. A family might just have enough to survive on and maybe sell a few animals. This here is a photo from a coal mine. So a lot of people, men in particular, were working in mines, which would have been quite dangerous conditions. They wouldn't have had the protective equipment that we have now. There wouldn't have been the same guidelines around safety. So often people were working in quite dangerous conditions. And we'll come back to that when we look at certain types of disease. And this here is kind of an early railway station in Australia. So trains were kind of up and running and moving people around the regions. And as I said, as people started to move from the country areas into the city, a lot of the railway services that exist now would have originally been built around 100 years ago or even a bit longer. Here you can see a pretty standard family for the times. So lots of children, and you'll notice the children are all very similar in age. So you can see how there would have been overcrowding in houses. If you look to the right here, this could be pretty standard, quite poor housing, probably on the outskirts of a city. So, you can see this family here. You could well have had families of 10 people living in shacks like this. And that obviously will contribute to health problems. In the bottom left and the bottom right, you can just see the development of the cities a little bit. So lots of construction going on, which created lots of jobs and brought people to the city. And down in the bottom right, that's actually in Melbourne, these would have been quite wealthy people that could afford to go out in the cities and dress up all nice. They would have been people with quite a bit of money. And this last picture is actually a photo taken. If you look at the women, you might get an idea of what their job is. So they're nurses, and this was a photo taken in a diphtheria ward in a hospital in Melbourne. So diphtheria was a highly contagious disease. And if you think of what we know about disease now, and especially right now, given what's going on with coronavirus, but the first thing we know with most infectious disease is that you need to be distanced and not be near people. And here we can see a bunch of kids in the bed out for a walk, but all in very close proximity to each other, which can obviously spread disease even more. So that's just a little overview of what life would have looked like 100 years ago. What we're going to cover today is really just looking at how certain aspects of health have changed over the last 100 years. So again, pause this for a second, and I just want you to think for each of the following four factors or indicators, how do you think they would have changed over the past 100 years? So pause now and have a little think. Okay, so life expectancy, we see a general trend all over the world that over time, life expectancy improves. And there's lots of reasons for this, but one of the main reasons is the quality of healthcare, the medicine, the technology that we have available. So that was definitely true in Australia. Over time, life expectancy has increased. Infant and child mortality, so remember mortality is referring to death rates. So over time, these have decreased. So less children and infants die than they did 100 years ago. And again, medical technology, understanding, education, and medicine have played a big role in that. So people are living longer, less children are dying. Age distribution, there is a graph that we'll have a look at. That basically refers to what percentage of the population are at different ages. So it's broken into different categories. So it's basically saying, are most of the population young? Are most of the population old? And over time, what we have seen is there's an increase in older age groups. Like I said, we'll look at a graph and I'll be able to explain that a little bit better. And then finally, the death rate, so the number of people dying, similar to the infant and child mortality, has decreased. So people are living longer, less people are dying, and there is some interesting cases where certain conditions have maybe seen increases in death rates while other ones have decreased. So we'll start off with life expectancy. This is our main one. We can see here in 1890, so 130 years ago, the life expectancy was between 45 and 50. Now, well, this is 2016, so if we went to now, it'd be probably a bit higher. We're looking at around 80 for our life expectancy. And across the board, females have always had a higher life expectancy. And part of that is genetics, part of it is social and behavioural factors. Infant mortality rates, in 1912, we saw about 80 out of every 1,000 boys would die. Remember, infant mortality is before the age of 1, and 63 girls. And now that is much, much smaller. So less than 4 and less than 3 per 1,000 deaths, per 1,000 births result in a death. So really, really big reductions in the number of children dying before their first birthday. This graph shows us the death rates of children aged 0 to 4 over time. Again, the general trend is that those death rates have decreased quite significantly. This is quite interesting because you can see a few big spikes. So around here, around the end of World War I, there was a big spike here, and we'll see this in other death rates, not just for children, but if you do history, you might know what this is about. This was the Spanish influenza, which happened or kind of spread around the world in 1918 after the end of the World War I. And you might have heard about it recently because a lot of people are comparing coronavirus to the Spanish influenza purely in the fact that it's kind of gone all over the world quite quickly, but that resulted in a lot of deaths. We can see here the death rates kind of flattened out a little bit, and there was a big decrease here. In 1928, penicillin was first discovered. Now, penicillin we'll talk about again in a different topic, but penicillin is an antibiotic which allowed bacterial infections to be treated. So historically, a lot of people died from bacterial infections, and then with the discovery of penicillin, a lot less people were dying from things like that. We see another peak here in the 70s. This is an interesting one. Again, we'll come back to it later in this topic, but the 1970s in Australia was a big time for cars. Lots of people started buying cars, and early cars didn't have seatbelts. So we know that kids in particular are at risk in car accidents of being thrown around because they are so small, and you do see a few spikes there, which were generally related to car accidents. This is the age distribution graph that I was talking about. Now, if you want to pause here to have a little look, it might be a good idea. There is a fair bit of information in here. Basically, what we're looking at is comparing 1900 and 2018. The pink represents females, the blue represents males, and the bits that are shaded in, so for example, if we go down to the 0 to 4, this shaded in section shows the percentage of people, percentage of people that were aged 0 to 4 in 1900, whereas the outlined one is the 2018 data. So the general trend that we see, I'll start with the 1900 data. General trend is that the majority of the population were young, and it's a real bell curve shape here. Majority of the population were young, and as age increased, the percentage decreased because most people started dying around this time, really. Around the mid to late 40s, people started dying and less people were making it up to these really high ages up here. Compared to 2018, that graph looks very different. So in 1900, the majority of people were young, were kind of under 25. Oops, sorry. Compared to 2018, the majority of people, so the thickest part of the curve, is around here. So the majority of people are in their 30s. Okay, so less people are having children. So we've got less children down here, or when they are having children, they're only having maybe 2 kids instead of 8. And then more people are living longer as well. So we're getting higher percentages of people up in those higher age brackets. This shows the death rates for all causes over time. So again, we see the first trend we can observe is that the female death rate is lower at all points in time in this graph. And the general trend is that death rates have decreased. And again, you'll probably notice the exact same spikes here in the increase in deaths after the Spanish influenza. So 1918, we see that nice drop here with penicillin. So that was treating infections in adults and children. And then again, we see these spikes here. Because we're looking at adults here as well, there are some other factors that would have contributed to these deaths here rather than just car accidents. There were other things that we'll talk about as we go on. As we look at this topic, we break disease into 5 categories. And these categories are pretty comprehensive, and you'll probably find that most diseases that we talk about or that you know of would actually fit into one of these categories. And that could be an interesting activity to do if you'd like, would be to maybe write down the names of 20 diseases, or even go ask your parents to name a bunch of diseases, and you could figure out which category they would fall into. The first category are infectious and parasitic diseases. We'll look at what that means in a minute, but these are diseases that can be spread from person to person. The next category we look at is cancers, or you'll see in your textbook as well, they are called neoplasms. So neoplasm is another name for cancer. And obviously cancer is a category of multiple different types of cancer. We have our cardiovascular diseases, and we're already quite familiar with cardiovascular disease. We've talked about that quite a lot, and you covered that last year. There's also respiratory diseases. So I'll just make sure you've got the distinction between these. So cardiovascular diseases are things to do with the heart and the blood vessels and the blood itself. Respiratory diseases are things to do with the lungs and breathing. There's often a big overlap. A lot of factors, things like smoking, are likely to cause cardiovascular disease and respiratory disease, but they are two different categories. And the final category we look at is injury and poisoning. So like I said, if you made a list of diseases or conditions, I'd say you could probably fit most of them into one of these 5 categories. So again, what we're interested in is how Australia's health has changed. And we're going to look at these 5 categories individually. So I would like you to pause here. You could write these down on a piece of paper, or you can use the slides that I've given you and maybe type into those. I want you to pause and have a think before we go through them. How do you think each of these categories might have changed over time? So particularly we're looking at the rates of the deaths caused by these diseases, but you might even want to be a bit more specific and start thinking about maybe the types of each of these diseases. So for example, cancers. Some cancers may have been more common 100 years ago. Other cancers may be more recent things. So pause that and then we'll start going through them, and we'll come back to this at the end. This is a good graph that shows the changes in death rates for each of those categories. You can see this down here. Now, I'll upload this actual graph. If you've got access to a color printer, you might want to print that out, or you could keep that in your online notes. We'll see, we'll start with the circulatory diseases. So this is this blue line here. So we'll see that increased over time, and there was a really big peak period in the middle around the 50s to 70s, and then it decreased again. We'll look at these individually in a moment. Next, we will look at the respiratory diseases. So this blue dotted line here. We saw a huge peak here. You might have guessed what this is by now. That was the Spanish influenza, keeping in mind that is a disease of the lungs. Big peak there, but then in general, a decrease, and it's been fairly flattened over the last 30 to 40 years. This blue line here is cancers. And you might be quite surprised to see that the death rate from cancers has been pretty steady over the last 100 years. It hasn't changed a huge amount. What has changed, and again we'll look at this in a minute, is the types of cancers. So cancers have always existed and kind of caused a lot of death, unfortunately, but the types of cancer has changed quite a bit. Our dark blue here is infectious diseases. So remember, these are our diseases that are spread from person to person or through contaminated food or surfaces. And we'll see it started quite high here. We got a decrease here, another decrease here with our penicillin. And then it's been very low since about the 1960s. Okay, not much death from infectious disease. And hopefully, I think we're very lucky to live in Australia. Coronavirus shouldn't cause a huge amount of death around the country. But this is the first time in a long time that people have actually been worried about infectious disease as a potential cause of death in Australia and in a lot of higher income countries. And our last one then here, the dashed line here, are injuries and poisoning. And again, it's fairly steady. There was definitely a bit of a decrease from the early 1900s through to about 1995, and then it's kind of stayed quite steady. Again, the types of injuries have you should have definitions written down for each of these types of diseases. It doesn't need to be super detailed, but it could definitely come up in your SAC or in your exam, define an infectious or parasitic disease. So infectious diseases are transmitted from person to person. They are infectious. They can be transmitted. Examples of this, well, let's start obviously with coronavirus, is the biggest one of our time. Things like tuberculosis, which was a really, really big problem affecting the lungs. HIV is an infectious disease. It can be spread from person to person. The normal influenza and colds. Sexually transmitted infections beyond HIV are also types of infectious disease. So there's lots and lots of different diseases that fall in this category. Parasitic diseases, think about what parasites are carried from different organisms. So an example of this might be through things like mosquitoes or ticks, leeches. Things like that are considered parasites, and they can spread disease as well. So things like malaria is a really common one in a lot of tropical countries in Asia and Africa. Lyme's disease, which is spread from ticks, and also a lot of the gastrointestinal diseases. So a lot of diarrheal diseases. If anyone's ever been, to Bali or something like that and gotten a bit sick, they're usually diseases that are caused from tiny parasites that you might not even see. So if we look at this graph was in that bigger graph of all the different diseases, but we'll look closely now at just the death rate from infectious and parasitic diseases. We can see it's a huge, huge, huge decrease from the early 1900s, where infectious diseases were one of the main causes of death, especially among children. That has decreased significantly, and since around the 1970s, it has not really been a cause of significant death within Australia. And this is an important thing to note. Around the world, in a lot of poorer or low-income countries, infectious disease remains a huge problem. But in Australia, with our access to testing, we've got very clean water, we have good facilities, and of course lots of medical treatment available. We don't tend to see people dying from these diseases as much. So next we'll look at cancers. If you remember back to our graph, cancers have stayed fairly stable over time. There was a little bit of an increase, but the actual rate of death from cancer has stayed fairly stable. Most cancers are caused by lifestyle factors. Not all. Some are caused, so cervical cancer is caused by a virus, and some are caused more by genetics. But most cancers are caused by things that people do. So you could pause here and have a think about those factors, these lifestyle factors. They are things such as smoking, alcohol, diet. So nutrition can have a really big impact on certain types of cancer, and things like UV rays, so being in the sun, as well as some chemicals. And these are important when we look at the changes in the types of cancers. So the actual rates of cancer have increased over the 20th century. So over kind of 100 years leading up to 2000. And there was a slight increase in deaths, but in general, the actual rate of cancer has increased, but people often live with cancer and don't die as early as they would have without treatment. Cancer rates peaked in the mid-1980s, and this is mostly attributed to smoking, which became very, very popular after the First and Second World Wars. Okay, so if you think about that, lots of people taking up smoking in, say, the late 1940s, early 1950s, 30 years later, that's when things like those lung cancers started to show up. Then we saw a decrease in kind of your lifetime in the rates of cancer, and we'll look a lot more at programs that aim to address things like cancer, but a big part of this was around education and campaigns to encourage people to make healthier lifestyle choices. The big thing with cancer that we've seen is changes in the types of cancer. So like we said, the rates have increased, deaths have stayed pretty stable, but the types of cancer has changed. So in the early 1920s, the majority of cancers were things like stomach or bowel cancers, and that was really due to the type of food people were eating. They wouldn't have been getting a lot of fiber. There wasn't much diversity in the diet. And if you think about even just the Australian landscape, wasn't always the best for growing kind of leafy, healthy vegetables. So stomach and bowel cancers were the primary cancers in the 1920s, and then in the 1980s, that increased to lung cancer. The third category that we looked at is cardiovascular diseases. So as I said, they're things to do with the heart and the blood and the blood vessels. They include things such as coronary artery disease, and that's if you kind of look at a heart, which looks something like that, there are lots of little kind of blood vessels on a heart, and they're important for providing blood flow to the actual heart muscle. Coronary artery disease is when some of these blood vessels get blocked and blood can't get through them. So that means the heart is getting less oxygen, so the actual heart muscle, and that in worst case scenario can lead to heart attack. And then also stroke is when, I'm going to do a really terrible brain here. A stroke occurs when there is a blockage in a blood vessel in the brain. And again, that means less oxygen, but this time in the brain. And depending on the area of the brain that occurs in, that can actually cause death or cause major issues for a person. Cardiovascular diseases, we know are caused by things like smoking, eating high fat diets, cholesterol. High cholesterol has a big impact. Alcohol can cause increases in cholesterol and in fat, and also decreased physical activity are all factors that can contribute to cardiovascular disease. We see over time there was a big increase in the rate of deaths up until kind of the mid-1980s, and then a decrease. Now, if you think back to the very beginning when we looked at the lifestyle that people had 100 years ago, that would explain why cardiovascular disease was quite low here, because in general back then, people were not eating a lot of fat in their diet. They didn't have access to chocolate and processed foods, so not a lot of fat in their diet. They were doing more physical activity. They were walking, they were doing physical jobs, so lower rates, and then those rates increased. So we may have seen things like smoking and alcohol, which became a big issue after the world wars, and a lot of that was to do with people trying to cope with some of the trauma and stress that they had been through. And then that kind of stabilized over the 20-year period around then. We also would have seen a lot of people getting cars around here. So less people walking around, so people being more inactive. And then over time, those deaths have increased. And this is the important thing to realize, that we're looking at death rates here. The actual rate of cardiovascular disease itself continues to increase in Australia because of things like obesity, poor diet, not doing enough exercise. So the number of people with the disease is generally increasing, but the number of people dying from it is decreasing due to things like our medications, our testing, the types of surgeries that are available now. So the deaths themselves have decreased. And if you think about why it might have peaked, they were things like smoking, alcohol, more people using cars, more processed foods coming into people's diets. Respiratory diseases is our fourth category, and so these are things to do with the lungs, so including things like pneumonia, influenza, asthma, and COPD. You might not have heard this term, and it probably will come up again. So COPD stands for chronic obstructive. So if you think about something that obstructs something, it gets in its way. Pulmonary disease. So pulmonary is another term for the lungs. So chronic obstructive pulmonary disease, or COPD, is basically when the air sacs in the lungs get blocked. And we'll look more at this when we look at the topic of smoking, but generally that blockage comes from mucus that is caused as a result of smoking. In the 1900s, so 100 years ago, most respiratory diseases were either due to people's jobs. So if you remember that picture I showed at the beginning of the people in the coal mine, so these coal mines had really, really bad air. People were breathing in a lot of dangerous chemicals and gases, and the actual fibers from the coal themselves. So that caused a lot of lung disease. And then, as I mentioned, the Spanish influenza epidemic that kind of started in 1918 and lasted a year, caused a lot of those deaths, the big spikes that we saw in the graph. By 2000, so 100 years later, the main type of respiratory disease was COPD, the chronic obstructive pulmonary disease. So we weren't getting people really working in coal mines and things like that as much anymore. The one-off Spanish influenza pandemic wasn't an issue, but we had a lot more disease of the lungs due to smoking. And I mean, it could be interesting. Australia is doing really well in our response to coronavirus, but around the world, a lot of people have died from coronavirus or from COVID-19, which is the actual disease. So when, in a few years' time, when other people are studying this course that you're currently doing, there'll probably be a peak in 2020 from respiratory disease deaths worldwide as a result of this. So again, we're kind of right here, like I was saying, that could end up looking like a bit of a peak in 2020 from the coronavirus deaths. But in general, we'll just look at these things. So we've got our Spanish influenza peak here, then a general kind of decrease, and then we had a few of these kind of peaks around here due to the COPD, so the smoking related illnesses. This is an interesting graph with most of the other disease categories. I haven't separated males and females, but with respiratory diseases, it is there's quite a big difference in respiratory diseases. So if we look at the females, the blue line here, huge gap between males and females in the 1960s, and we'll see that that gap has really closed here. So there's almost as many women dying from chronic obstructive pulmonary disease as there are men. And that is a result of probably a few more women taking up smoking and also maybe less men starting to smoke. So there's less of a gap there between what traditionally was a very kind of male lifestyle factor. Our last category that we're going to look at is injury and poisoning. Now this is a really broad category, and you should definitely be writing a definition here, and it's probably good to know what the main types of injury and poisoning are. So motor vehicle accidents, so car accidents, motorbike accidents, even pedestrian accidents, they're one of the main causes of death from injury and poisoning. Assault is another one. So things like fights or very bad violence comes in that category. Poisoning, that could be intentional, or it could even be things like food poisoning or alcohol poisoning, which aren't as common in Australia as they are in other places. Drowning, and this is particularly a big one with kids. Children are more likely to drown than adults. Burns, again, these can be occupational, so some people might suffer burns in their work, or it could be accidental from things like bushfires, even car accidents, falls, and suicide. So that falls under the injury and poisoning deaths, and we'll have a look here at the data for that. Over time, general decrease in the number of deaths due to injury and poisoning. But if you looked at this list, you'd probably think that there's been changes in the types of injury and poisoning. So our first big peak here is World War I. So death due to injury in combat would be covered in this area. So big peak in World War I. Another peak here in World War II. Sorry, there's another W. A lot of people died due to World War II. This actually is an interesting peak here, especially if you're a history person, you might find this one interesting. This was during the Great Depression, so when people were really, really struggling to afford food and things like that. And that was a significant cause of suicide in a lot of men in particular. We saw another peak here. Again, if you're a history buff, you might know what was happening in the 60s and 70s. So that was the Vietnam War, and even actually the Korean War before that. So a lot of Australians fought in those wars. And then since then, we've seen a bit of a decrease. A few peaks here. They could be due to things like, car accidents, which falls into this category. Okay, so general decrease over time, but as you know, I love my data, and there's a lot you can get from looking at a graph and really starting to think, wow, what caused that peak there, or what might have been happening. The highest death rate for motor vehicle deaths, so we were looking at all deaths before, But if we look just at motor vehicle related deaths, it was at its highest in 1970, and it's reduced since then. And if we looked at information on car ownership, there's probably a lot more people that own cars now, but less people are dying. And that's really due to things like increased safety of cars. So if any of you have bought a car or are looking at buying a car, you'll probably know that a car has to meet certain safety specifications to even get registered. We've got better roads. So the quality of roads is much better. We've got things like pedestrian crossings, which didn't really exist back then. You just ran across the road, and if you didn't see a car, you didn't see a car. There's a lot more laws in place to protect people. So things like our speed limits, drink driving limits, all of those kind of things, and also seatbelts. Seatbelts is a massive thing that has reduced a lot of death, especially amongst children. In the early 1900s, a lot of the deaths from injury or poisoning were work-related deaths. And they would have been due to kind of unsafe working conditions. So again, thinking back to the people who were working in mining or in farming or even construction, there wouldn't have been a lot of harnesses and things like that. So a lot of work-related deaths back in the 1900s, whereas now there's a lot more workplace safety, and businesses will get fined a lot of money if they're not providing safe working conditions. Okay, so that's the 5 categories of disease that we started off with. So with our infectious and parasitic disease, and it might be nice even in your notes to draw just a really simple graph for each one. So the general trend with infectious and parasitic disease was a very strong decrease over time. With our cancers, if you remember from that first graph, it's been pretty steady, bit of an increase, but the death rates from cancer have stayed quite steady. The types of cancers, though, have changed. Our cardiovascular disease, we saw a really big spike around the 60s, 70s, 80s, and then a decrease. Again, that's just looking at deaths. There's still a lot of people living with cardiovascular disease, but less people dying due to medical treatment. Our respiratory diseases, we had kind of started quite high, things like coal mining. We had our Spanish influenza peak, and then it has kind of decreased, increased again with smoking, and then has decreased now. And then our injury and poisoning, again, we had a few peaks. World War I peaked. We had another peak in World War II, the Vietnam Wars, a few car accident related things, and then has kind of steadied off a little bit. So looking at the data there, you can really see how even though over time people are living longer, so life expectancy is increasing, so that's life expectancy, and death rates in general are decreasing. When we look at individual causes of death, their story's not. So what we've covered today is looking at the improvements in Australia's health since 1900. We've started touching on some of the reasons for these improvements, but I think it's really important that you get your head around how the health has changed. And over the next week, we're going to look a lot more at specific reasons for those improvements, particularly things to do with policy, so to do with kind of the laws and campaigns around health, which forms a big focus of the Unit 3 work. So please make sure you've taken all your notes for this. There'll be a separate video that introduces us to the old public health and the biomedical approach. And then I will be asking you to complete a Google form just to answer some questions and show that you've understood this information. Thank you.